A strep throat infection and a sinus infection, though often confused due to some overlapping symptoms, are distinctly different illnesses caused by separate pathogens. Strep throat is a bacterial infection known for causing a sore, scratchy throat and is often accompanied by fever, swollen lymph nodes, and red tonsils, sometimes with white patches. In contrast, a sinus infection, or sinusitis, is characterized by a stuffy or runny nose, facial pain or pressure, and can be caused by either bacteria or viruses, leading to headaches and a decreased sense of smell. Treatment for strep throat typically involves antibiotics to fight the bacteria, alongside rest and hydration, while sinus infections may resolve on their own or may require decongestants, nasal sprays, and sometimes antibiotics in the case of a bacterial cause. Those with weakened immune systems or with a history of frequent throat or ear infections may be at higher risk for developing these diseases. Here's a deeper dive into both strep throat and sinus infections, detailing aspects such as their transmission, complications, and strategies for prevention and management. Causative agents: bacterial, Streptococcus, versus bacterial, viral, fungal, allergic. Understanding the causative agents behind strep and sinus infections is crucial for effective management. Strep throat is specifically induced by the bacterium Streptococcus pyogenes, presenting with a severe, sudden sore throat, fever, and white patches on the tonsils. On the other hand, sinus infections can have a broader set of instigators. They may result from bacteria similar to those causing strep, but viral infections are the most common triggers. Fungin allergies can also lead to sinusitis, especially in individuals with compromised immune systems or nasal polyps. Recognizing the root cause is essential, as it dictates whether antibiotics are necessary or if alternative treatments would be more appropriate. Primary symptoms: throat pain and swelling versus nasal congestion and drainage. Distinguishing between strep throat and a sinus infection pivots on recognizing their primary symptoms. Strep throat, caused by Streptococcus bacteria, presents with sudden severe throat pain, difficulty swallowing, and swollen tonsils, often accompanied by white patches. Fever is common, but coughing isn't typically associated with strep. In contrast, a sinus infection, which may be viral or bacterial, triggers a constellation of upper respiratory symptoms. Nasal congestion, thick and discolored nasal discharge, postnasal drip, and sinus pressure or headache prevail. Unlike strep, a cough and a range of other cold-like symptoms might be present, stemming from the affected sinuses and irritated airways. Identifying the key characteristics helps physicians ensure accurate diagnosis and appropriate treatment. Common complications: rheumatic fever versus chronic sinusitis. When distinguishing between strep throat and sinus infections, it's crucial to consider potential complications. Strep throat, caused by Streptococcus pyogenes, can lead to rheumatic fever if untreated, a serious condition that can damage the heart valves and joints. Prompt antibiotic treatment is crucial to prevent this. Conversely, chronic sinusitis, often arising from prolonged sinus infection, can lead to persistent inflammation and blockage of the sinuses. Chronic sinusitis might result in decreased sense of smell, facial pain, and potentially serious infections spreading to nearby structures such as the eyes or brain if not properly managed. Identifying each disease's risks underscores the importance of accurate diagnosis and timely intervention. Treatment focus: antibiotic therapy versus symptom management and antibiotics, if bacterial. When distinguishing between strep throat and sinus infections, treatment strategies significantly differ. Strep throat, caused by the bacterium Streptococcus pyogenes, typically necessitates antibiotic therapy to eradicate the infection and prevent complications like rheumatic fever. On the other hand, sinus infections can be either viral or bacterial. Viral sinus infections don't benefit from antibiotics and are treated with symptom management, such as decongestants and nasal irrigation. However, if a bacterial sinus infection is confirmed, antibiotics may be prescribed. It's essential for healthcare professionals to accurately diagnose these conditions to avoid unnecessary antibiotic use, which can lead to antibiotic resistance and harm the body's microbiome. Typical onset: rapid versus gradual. Strep throat, caused by the bacterium Streptococcus pyogenes, usually has a sudden, rapid onset. Patients often experience a severe sore throat, pain when swallowing, fever, and swollen lymph nodes in the neck abruptly without prior symptoms of illness. In contrast, a sinus infection or sinusitis can develop more gradually. It often starts with the common cold symptoms, such as a runny or stuffy nose and facial pain or pressure. Over days, these symptoms may worsen or fail to improve, leading to a diagnosis of sinusitis. Recognizing the nature of onset helps clinicians distinguish between these infections for proper treatment.